Good morning, everybody. I'd like to introduce our first keynote speakers. I first met Professor Andy Miah last year down in Bristol. We were at an event together, and fortunately we shared a train back up north, and I invited him to be a keynote here today. So Andy and Emma, who are both colleagues, and I'm sure you'll hear more about their work and their future events, they're going to give us their keynote today. And our lunch session will start at approximately 12:15. If it overruns, not to worry. I'm sure there'll be some great discussion and Q&A later. Thank you very much.
Okay, well, it's a pleasure to be here. I studied a lot in Bedford and haven't been to Milton Keynes for yonks, so it's really nice to see the place a bit and get a sense of how it's changed, or not, as some might say. We have a couple of things we want to do today. Emma and I have been working on this subject. Actually, I found an email between us that was starting a book project in 2002. It took 6 years for it to come out, which I'll say less about. But it did sort of begin about just over a decade ago. And we kind of want to begin by taking you back a bit and thinking about partly what's happened over the last sort of 15 years in digital healthcare. But also just sort of set the scene for where we are right now, which is sort of 10 years since the book came out. And in many ways, that hopefully will be instructive in terms of our present research project, which we'll go on to talk about in some detail, which is focused on looking at how young people are engaging with digital health. So over this sort of period, when we first kind of got started and reading articles about cyber medicine, which you don't hear that term much anymore, it sort of drew us to write about how the internet was becoming this kind of medicalized space. And at the time, it seemed particularly concerning for us for a number of reasons. One is that it seemed to, on the one hand, put people in a position where they are transferring their sense of authority perhaps from traditional means of information to something that is a much more of a kind of Wild West. But this image that was the cover of our book is a version of an artwork by a woman called Marilyn Oliver, and the work is titled "I Know You Inside Out," which seems like a nice sort of metaphor for thinking about where we are today as well. The degree to which medical surveillance, digital medical surveillance, is occupying every part of our lives, not just the external aspects of things that we share on tracking, but also increasingly, as we'll go on to talk about, its capacity to be something that tracks our internal workings as well. So the medicalisation of cyberspace sort of came at a time when the internet, the Web 2.0 era, was still just kind of getting up and going. At that point, Facebook had a mere 100 million monthly users, and it's now at about 2 billion. So there seemed like a lot of things that were about to change at that time, and a lot of challenges, a lot of attributions have changed to the internet. And that's one sort of theme we kind of want to pick up on as well, the idea that the internet is kind of imbued with concepts around change, and particularly behavioural change. You only have to think of the sort of emerging tradition of people going out to dinner and putting the mobile phones in the middle of the table, and the first one to pick it up pays the bill, because we're just too much immersed in that world now, and we kind of find it frustrating in some respects too. But it was also at a time when we kind of could see that some of the origins of it were as kind of peculiar as they are now. This is a screenshot from a website at the time called Ron's Angels. Does anyone remember Ron's Angels? So it's interesting to sort of look at this, particularly in the context of fake news, which is, of course, an important subject, particularly around health information. But Ron's Angels was a platform that was set up purporting to auction off female ova and male sperm. You could buy the genes of your children, and this is obviously one of the donors, female donor, and this is a male donor, and you can decide whether in fact these two have the attributes you seek to pass on to your children or not. But that was the proposition. This was an era where we could imagine the internet delivering kind of all kinds of commercialized versions of healthcare that perhaps previous we would find sort of troubling, such as auctioning off our genetic materials. It turned out, however, that Ron Harris, the guy behind this, was a pornographic film director, and this seemed really to be a bit of a hoax, a bit of a prank. And yet 10 years later we're talking about fake news as if this is something completely new. So the internet back then was sort of ridden with some of the concerns that we see now as being particularly prominent, not least of which is being able to verify and authenticate information that has an important bearing on our life and how we lead it. But Ron's Angels was one example of that. And I remember, even back at the time, speaking to colleagues who would sort of dismiss things like Wikipedia. I mean, I remember colleagues who would discourage students from using Wikipedia, which now is the go-to place for anyone of any educated level to find out information. And so a lot has changed there in terms of our willingness to recognize information as authoritative, and also our capacity to navigate in ways that are perhaps effective and useful to us. But there's a few things that I think concern us about the way in which we approach digital cultural studies. One has to do with the sort of perpetual sense that there is nothing we can really learn from the past because, in fact, everything's changing so quickly that it doesn't apply. Digital history seems to be ridden with this idea that, in fact, we have to kind of keep innovating, keep modifying. And, in fact, data becomes very difficult to compare from one year to the next because those platforms change as well. So if 5 years ago we were looking at Facebook as our data, we may not be looking at it now because people may not be using it. So, and yet we kind of want to say that there is something we can learn from the history of digital transformations that should inform how we think about our own research in digital studies today. One of them has to do with planned obsolescence, this idea that in fact the devices that we have are designed purposely to become obsolete. Now, if you think about it in the context of healthcare, this is particularly important, especially when you get into things like continuity of care, the possibility of having a persistent medical record. I have used sort of fitness tracking for a while, and I used to use a Nike running app, and have now moved to Google Fit. And for quite a long time, it's been very hard to move data from one place to another. It's been even harder to look at the raw data sets and really do anything with them. So there's a sense in which these platforms, these walled gardens in which our data is located, restrict our freedom, although they're sort of imbued with values of empowering us, that we can track ourselves now and we can get all this data and get insights into what it means. It still sort of keeps it situated within a particular economic framework. So the idea of planned obsolescence, how should we approach that when we recognize that organizations like the NHS are working with companies who operate with this sort of value system, that in fact there is no kind of long-term in digital healthcare? How do you work with that sort of principle in mind? Another learning point perhaps is to consider the idea of digital discontinuity. There's a really interesting book called The Fourth Discontinuity, published about 20 years ago by an author called Bruce Maslish. And I think we can extend, and he talks about technological discontinuities and how they have transformed societies. So you might think about the genetics era as one of them. You might think about the rise of the internet as one of them. Within digital healthcare, I think we can also apply this notion of discontinuity, in part because it's apparent that whilst the technological apparatus change and create new kinds of behaviours, there is a certain connection between that remains. So this is an image from a magazine, as you can see, from 1924, which talks about and has been cited as a first example of kind of telemedicine. And yet the problem is partly that the emergence of a new platform is often to the complete failure of the previous one. And so there's a kind of, I think there is certainly an economic explanation for this, in that we are sort of being moved from one place to the next in order to fulfill the commercial aspirations of those new platforms. You think about the recent examples of Apple being criticized for slowing down their devices, their older devices, because they want you to buy a new one. The response by them was that, in fact, that's what's necessary in order to optimize the performance of that older device. But you can see how the infrastructure compels us towards reinventing things, and that's something perhaps also we should take on board. How do we design digital healthcare, bearing in mind that in 5 years' time, the things that we're using, the platforms we're using, won't exist? Another aspect that we may learn from is the idea of limiting our data footprint. Now, you will have seen in the Cambridge Analytica discussions that there's a lot of anxiety about our cognizance of what happens to our data as we share it and allow organizations to do things with it. But beyond that, our capacity to even imagine how our data is utilized is perhaps really challenging, and making that more explicit is perhaps something we can learn. One nice example of that is a story from a couple of months ago, I think it was, which was when Strava released their tracking heat map, and it became apparent that soldiers that were working within a military base using Strava to track their runs suddenly gave a nice blueprint of the military base for all to see. And of course, there's all sort of outrage about this. How could this be? This is completely compromising national security. And so understanding the potential is really challenging, because in our use of a device, and I think this is true of all systems that we use, whether they're social media or tracking data, the choice we make when beginning to use these things and the ways in which we imagine it being used don't stay the same. Platforms evolve, our use of them evolves, and the monetization of the platform and its need to change evolves too. So again, trying to build and design digital healthcare for a world in which these things are not static is I think, one of the challenges. So this leads us on to thinking about where we are now and this digital health generation project that we have. And I'm going to hand over Emma to introduce the project.
Thanks, Andy, and thanks, Hannah and organising team for welcoming us here today and giving us some time to talk about some projects that we've been involved with. And as Andy has mentioned, it's sort of 10 years on now since we wrote the Medicalisation of Cyberspace. So I think thinking through some of the implications of what we've begun to talk about today in terms of young people is really exciting for us. I think partly because there are some, if we like, assumptions about what young people know, what they're doing, and actually what the research tells us is that we don't really know how young people are using data, how they interpret it, and the impact that that's actually having on their health practices, on their behaviours. And it's really exciting to see such a diverse range of abstracts and papers at this event, some of which are, I think, touching upon some of the specifics in terms of what young people are using and the implications of that. So I'm going to talk a little bit about the project that Andy and I are involved with two other colleagues, actually, who obviously aren't here today. So Deborah Lupton, many of whom I'm sure you will know, at Canberra, and Dr. Sarah Lewis, who's also based at the University of Bath. So the four of us have been working on this project for about 18 months now, and we'll be finishing in December. And really, the sort of driving question behind this is to try and understand the impact of kind of healthy lifestyle technologies. And when we think about the vast range of apps, platforms, wearable technology that would fall under that category, it's quite a challenge in terms of trying to understand what young people are using and why, and what they might be learning in that process. So, why this generation? Well, as Andy sort of alluded to, you know, the rapid pace at which things develop, I think there are a number of assumptions about what young people are growing up using. And I think we see this term digital natives used quite a lot when we're talking about young people. And we'll talk a bit more about that today in terms of unpacking and some of the concerns that we have in terms of what do we really know about that and what do we assume about young people as a group, as a homogenous group. We know that they're at risk. There's plenty of literature and research out there that shows that young people are quite active in terms of practicing and sharing data about themselves, whether it's selfies or the sort of confessional statements that we now see as quite everyday. We know that they are subjects of surveillance. So some of the very interesting work by Ben Williamson, looking at how digital data technologies play an increasing role in the collection of data and governance of young people's lives, particularly within education. So we're seeing big data companies coming into education, collecting data on them and making certain claims about young people. And we're interested as well in terms of the role of formal institutions. So rather than just looking at what young people are doing online, what are the role of the people around them, whether that's health organisations, teachers, parents, the kind of networks that might influence how young people are involved in various sort of data practices. So we see in the literature and in the media different references to young people as the app generation or digital natives. And we've been particularly interested in sort of unpacking that implied discovery and why in particular young people are the sort of target of many digital campaigns. And this idea that they're a sort of homogenous group who are able to access the internet, navigate digital worlds, we're fairly sceptical of this. And what we're seeing in our research is that yes, some of them do have those skills, but there are a range of inequalities and risks which we haven't really explored fully yet, and the complexities of that are quite vast. And we found the work of Sonia Livingston and Ellen Helpser really useful in thinking about, rather than a kind of notion of digital natives and the sort of generation gap, thinking in terms of what they refer to as a continuum of digital inclusion. So thinking about some of the forces that might shape how young people engage with the digital, whether that's geographical, family, socio-economic, spatiality, cultural forces, all of these things limit the opportunities and practices in terms of digital health engagement. So that leads us to just telling you a little bit about our research questions and how we're approaching some of those challenges. So the first is that we want to identify how commercial technologies, again focused on healthy lifestyle, are being used by young people, and then looking at what are the implications for their impact on health practices. So I'm sure many of you are aware that the sort of typical 6 weeks of using apps and then moving on to the next one, downloading another app. Many of our young people were telling us that, well, I used the Fitbit for a while, it broke, or data wasn't working, so on and so forth. So there are some kind of practical issues around the design and architecture of certain technologies. But what do we really know about the impact in terms of health and health practices? And what's interesting for us is that we know that many of the young people that are using tracking devices are those people that are already quite active. So in terms of targeting those who are inactive, how useful are some of these technologies and how innovative are they? What do we really know about how successful they are? And part of our challenge really is understanding the contextual factors, so not just the actual engagement with the device, or the kind of, thinking through the kind of post-human relationship in terms of that, the affect, how it feels, how we use it, but also where is the young person in all of this? The resistant, the way in which they might use technologies in unexpected ways or unintended ways. How do they discover, select, adopt, share, employ, resist, or reject the information and assumptions about health and bodies? And particularly interesting when we think about the potential for creating their own media and their own health knowledge through various platforms such as social media or YouTube.
I mean, just on that to add, I mean, my son's 7 years old and all of his friends have Fitbits, which I found staggering, really. And yet, I remember when he was sort of 5, getting a kind of internet safety information from the school, talking about some of the concerns about being online. And now not only do his friends have these devices, I don't know enough about how the child perceives the use or what happens to the data. But he's got friends that have their own YouTube channels and so are very publicly visible. And a few parents sort of expressed concerns about that. So even our sort of cohort of 11 to 18, some of these sort of habits are really grounding in much earlier even.
And that relates to the role of people like parents. So fitness trackers now that are advertised as toys, play devices. Many of you have probably seen the adverts for these, but who makes these decisions about what young people might be using or what data is collected on them? So there's also this issue of how they're being pushed into digital health technologies. So this is helping us to think through, if you like, a relationship between sociology. My background is primarily sort of in sociology of education, so I'm interested in how young people learn about health, both in formal institutions, but now through other means in terms of the vast and sometimes contradictory health knowledges that are available in these digital environments. And then thinking through the kind of bioethics of some of these and what the future might look like in terms of the design of these technologies. And finally, we're interested in these, as I said, these broader social contexts which influence, whether that's in terms of deciding they're too risky, some of the reliability discourses that are still very prominent in the way that people think about the internet, and increasingly, you know, security and safety at a younger age. But what are the social inequalities? So if we think about this move towards the digital infrastructure of healthcare, who might get left behind in that, and what kind of inequalities might we need to think about in terms of policy and ethics of healthcare? So in terms of our data collection, we've completed a large-scale survey of over 1,000 young people, and our focus there was really mapping some key milestones in terms of what were they using, at what point did they have their first mobile phone or tablet, what point were they accessing the internet, what did they use for health, what do they see as reliable, what are some of the tensions, how are they navigating these digital spaces. That kind of gave us a nice overview in terms of mapping out the sort of key areas of influence, social influences, but also their preferences in terms of what particular social media were they using, what hashtags, that kind of level of information. We then have undertaken a series of in-depth interviews with some of those young people, and we're hoping that through that qualitative data, what we'll end up with is a kind of unique insight for health professionals and policymakers, which will enable them to develop safe and targeted digital health policies and practices. So issues there around trust, reliability, inequalities, disparities of risks, and thinking also about those who haven't adopted digital health tech. So we've also interviewed those young people who aren't actually using it and trying to get a better sense of what those barriers are. Again, particularly important when we think about with health and fitness, users tend to be those that are quite physically active anyway in terms of young people. And finally, and we're just entering this phase now, we're working with a diverse range of families, and thinking back to that issue of context and family influences, we're using, experimental, but we're using WhatsApp. We're interviewing families before and after, and then there's a sort of six to 8 week period where those families are trying different technologies, and we're actually speaking to them in real time through WhatsApp. And the reason behind that is that we wanted to get away from this idea of kind of thinking back retrospectively to what they used and trying to get a better sense of those contextual factors. Where are you when you're accessing your data? Why did you just post that statement about going for a run? And using a range of kind of multimedia, photographs, videos, audio recordings to really build up that rich picture of spatiality, family environment, and those kind of contextual influences. So that's the project, and what we'll do now is sort of work through some of the themes that are coming out of that, but also the kind of broader aspects of digital health technology challenges in terms of designing for young people.
And as Emma said a moment ago, a lot of this is to work through some of the conceptual and theoretical aspects of this subject. And one of the things that we're sort of interested in broadly is that life course within digital health. And even that notion of the digital health generation is sort of one we kind of problematize, because you could argue certainly that the cohort we're looking at are the first generation who are using this and have only used this in their lifetimes. We, of course, are all members of this new digital health generation. All of us who use any of these platforms are the test subjects for it, whatever age you are. So we're sort of interested in how we can learn about that transition over different parts of their lives from one platform to the next, and whether there are moments of particular interest over one's life with regard to kind of openness toward digital health, or whether there are blocks in terms of information or access or literacy, and how that changes over the lifetime. But part of that is coming to terms with just some of those trends over these years. And if you think about what has happened over the last 15 years of digital development, there's just so much that's taking place. And even mapping out that environment is quite challenging. Often it has to do with having more of everything. So here's some examples. We have here the connected mirror, which you look into and will tell you how well you are based on its facial reading of your skin, of your expressions. And some of these things we know aren't quite here yet, but are around the corner, and partly preparing for that is one of the things we're quite fascinated by, along with this broader sense of there being a kind of ambient health environment in which we are located. So it's not just about us tracking ourselves individually, but how that environment's also being tracked as well. There was an interesting project in Manchester, which is where I work, from a couple of years ago, an art project really, but it was essentially taking the idea of conveying environmental data, particularly air pollution, to people using clothing that would change colour the more populated a location was. So here we have the potential to provide health information through clothing in a way that tells something about the ambient environment too, which may have health implications. We're also conscious of the fact that there's just more health data around, and this is a kind of bottomless pit really, particularly because the notion of what is health continues to expand. So the example we kind of like to use is Spotify, which allows you to select music based on your mood. And whilst most people, I think, wouldn't consider Spotify to be a digital health platform, you could imagine how the information may be used to infer mental health states based on the choices you've made. At the same time, even platforms like Instagram, which are using which someone's developed an image recognition software to transfer images of products into calorific information. So these platforms alone have become, or are becoming, part of that digital health environment. We also have, and we'll talk a bit more about this later on, the development of artificial intelligence. And one part of the project we'll go on to mention a bit is how young people feel about AI. So you'll be aware that Babylon Healthcare Limited has been working with the NHS over the last 6 months experimenting with the rollout of their AI application. And we wanted to, has anyone tried it at Babylon? Anyone had a go on it? So this is essentially a chatbot with which you talk, with which or with whom, not quite sure which to use there, you talk and explain your symptoms. You could, this is me having a go on it, which you can see the sort of initial conversation at the start, where they ask what's up, and then I tell them what's up, and they tell me, ask a series of other questions to figure out the specifics of what's going on, and then arrive eventually at some kind of diagnosis. Now, the thing to bear in mind is that a lot of this is being driven by an artificially intelligent program. The final recommendation message is, and I've obscured this, is from an individual. And you could argue that, in fact, the entire platform is set up to steer you towards, ultimately, a kind of a face-to-face consultation, and in many cases, a privatized face-to-face consultation. But what interested us about Babylon is two things, really. One is the sort of growing inclusion of AI within our everyday lives. And I've heard over the last 6 months, in fact, just this week, someone was telling me about a friend of theirs who has a home assistant that's now their kind of best friend. And it's become part of their lives in a way that you would think, gosh, that's odd, isn't it? It's a computer. But it's actually becoming a presence within their lives, and almost a reassuring presence that's rather like having company than having a machine. So there's a growing sort of trend towards machines being imbued with personalities that we are able to relate to, along with the fact that what's appealing about this platform is that it's a text-based interaction. And whilst you might think that having a conversation with someone is preferable, there are many people that have been unhappy with things like the NHS 111 service, would rather not have to pick up a phone and speak to someone and go through a kind of a call centre to get to the thing they want, or indeed just feel more comfortable texting. And so here we have again a kind of behavioural change over the last decade where messaging has become the normal way of interacting with people rather than being the exception. more self-management. We see this discourse around in healthcare generally, but this push towards using more apps to track more of our data, to be able to take control of our health and our future, is one of those ever-increasing, almost limitless aspirations that healthcare has of us. Being more online, being more mobile, many of these things are delivered by both of those elements. Mobile devices are enabling a lot of this, to the point where there are platforms like this now that you can download that will restrict your connectivity and stop you from being online. I think you can look at also the idea of the sort of headspace movement, this idea that we kind of try to crowd out the digital world because it's just too pervasive and too essential to everything that we do. And some of our quotes, I think, from our participants speak to this idea that, in fact, we're just overwhelmed with technology. So, but it's a condition of our sort of digital citizenship to be able to do this. So, I'm going to pass over to you.
Yep. So we'll just sort of share a little bit of what we found so far. Probably not too surprising, but 75% of the young people that completed our survey, they owned their first mobile or tablet between the ages of 8 to 11. So there were certainly some that were online and using devices at a younger age, and some where that came later in their childhood. But for the majority, between the ages of about 8 or 11. 55% used their mobile phone for health in various ways, whether that was apps or searching online, and 52% use apps to track whether that was their diet, fitness, sleep, various aspects of their health. Instagram and Snapchat were their favourite social media platforms for health, and I think that has really significant implications when we start to think about images of particular body types, very narrow ideals in terms of maybe photoshopped images as well, movements around food cultures, dieting, fitspiration, these kinds of things.
Just to add there, one thing we're sort of very conscious of is we're sort of developing this idea of device ethnography. That, how many people on Snapchat here? Hands up. 3 people. How many people understand Snapchat? I mean, one of the things we're so anxious about is the degree to which, as researchers of this subject area, our capacity to feel that we understand these environments at all, never mind being part of them, but actually just understand them. So as Emma mentioned earlier, the WhatsApp aspect of the study, which is quite accessible to us because we use WhatsApp a lot and understand how it works, it feels like we can be present in that world in a way that is similar to how the subjects are present. But we think one of the key things is in this area of research, how researchers are really aware of or immersed within those platforms. And I think we'd argue that if you are going to study them, you may actually need to make sure you feel part of those worlds. Not necessarily part of the worlds of the participants, but actually understanding Snapchat if you're going to research it.
I think that's really important actually because many of the participants have started with the assumption that we don't know what those things are. The age gap, that generation difference, and they've said to me, you're on Facebook, aren't you?
But it's also sort of interesting because, historically we've theorised about digital culture, digital space. And I remember when sort of the cyber libertarians were writing about this, what was sort of interesting was the kind of anonymity of being online, and then we got very anxious about the sort of digital footprint that's always going to be there. And so Snapchat and this sort of ephemeral content that disappears after however long you choose is sort of indicative of another sort of shift in the value system of the people that use it. You don't want to have your digital footprint left there, whereas perhaps sometime in the past we might have wanted that.
Yes. So YouTube was reported as the top site to help them understand about health, which again we thought was quite interesting in terms of then when we started to unpack that, they alluded to just how difficult it was to find the right people to follow. And a lot of participants sort of said, well, I do what my friends do, or I follow one thing and then a series of recommendations come up. So that kind of life that data has in terms of algorithms and recommendations is also quite interesting in terms of how much is being searched for and how much is being brought to young people. There was also, I think, when we started this project, we really didn't know what we were going to find in terms of what young people were using, their willingness to share data, what they were sharing. And I found this particularly interesting that, 64% of them said they were willing to share or do share data with their parents. So when we started to sort of drill down a bit further into the interviews, what we found was that actually this is an interesting family influence in terms of potential inequalities around health. So by way of example, there was one girl who sort of spoke at length about how she ended up tracking. And it was because her father was an avid user of a cycling app, and they started to talk about what the data meant, and then she started tracking herself. It became quite competitive, and it was something they did as a kind of family practice. But there is something in that in terms of young people repeatedly telling us, I don't really know how to make sense of this data, and I need somebody there who I trust that I can talk to about this. And for many of them, it was their parents. So I think, there's something there to explore further in terms of what they were willing to share. And of course, there were certain things that they certainly wouldn't be. But it becomes a key influencer. And when we think about inequalities, if you don't have somebody like that there to help you make sense of that data, many of them were saying, I just don't understand it, or I stopped using it. So that became a key influence for us. So that helped, those interviews and qualitative data helped us to make sense of that finding. And then, of course, health professionals, friends, and so on.
I mean, there's something also interesting about the reconfiguration of space that's happened over this 10-year period as well, where I remember growing up with a computer in my bedroom, and your parents would never really come up there, whereas it being on mobile means that it's perhaps more present in multiple spaces now, and where those sorts of conversations may happen, which has completely changed how it's shared and the willingness to share.
Yeah, and we're hoping to get at that, aren't we, through the kind of phase 3 and that real-time data collection, and then talking to families as well about the impact that had. So 45% reported that they worried about incorrect information. So I think that kind of reliability discourse is very present. And we can sort of unpack that a bit further in terms of what were the key signifiers in terms of knowing something was safe. And there was a real desire to have systems out there, logos or whatever it might be, to help them navigate the 160,000 apps and growing. How do you choose? What should you use? So we just actually not long ago had a webinar, which is available online through our project website, with Hazel Jones from the NHS Digital team. And some really interesting responses from them in terms of being fully aware that they need to have a sort of recommended library which was responsive. So, this idea that people use apps and then they move on. So how do you sort of deal with that in terms of making recommendations, and how flexible and responsive are the systems? So there's also the kind of user reviews. Some young people were telling us, well, when I do a Google search, I know that it's safe because it's come up in the top 5. So just sort of taking the top things from the search results. Well, lots of people have used it, so that would be a good indicator for me. Or also looking at kind of, star ratings or user reviews, that was also helpful. So that's an interesting tension between these kind of very authoritative, official recommendations through the NHS, and then also thinking about what's popular or what people are using and rating for themselves.
I don't know whether any of our data has spoken to the idea of the filter bubble and awareness of that from participants. No. So this idea that, in fact, the results that are returned to us when searching are informed by our previous activity. And, in fact, if you don't log out of Chrome, you probably don't see what a search looks like without that influence. And again, it's sort of, looking at digital literacy and how we address those sorts of things.
So another aspect that Andy's mentioned already was this issue of automation, algorithms, and AI. So, and again, we found a real tension here between this idea of personalization being a good thing, that yes, I want a more tailored response about me and my health. And if that comes in the form of algorithms or automated responses through the data that's collected on me, then so be it. And then also this notion of it being dehumanizing and sort of not talking to a face-to-face person. So that this idea here of no humanity, and it's all computers and that. So you can see these discourses, the fears around the speed at which technology might be taking over. They're also very aware of this, I guess, the discourse around healthcare crisis, and that this may be a more efficient way for people to manage their own health. So certainly that neoliberal thinking around health and why it's helpful and being a good citizen was very in their thinking about, well, okay, how helpful are these apps, these technologies? And again, the sort of tensions between wanting to talk to a person face to face, and then also acknowledging that, well, actually, the idea of talking to a bot might be really good for some things that I just wouldn't be comfortable sharing with an adult. So some very mixed reactions coming through in terms of picking up on automation and personalization. And this idea of digital health being boundaryless, and I think this is a really interesting thing to think about in terms of what we already know about some of the concerning health practices that young people already engage with. There is an extensive body of literature out there around the impact of kind of neoliberal health imperatives in terms of working on the self, and the disaffection that young people might feel around their bodies in terms of over-exercising or problematic relationships with food, self-monitoring, surveillance, and there was a concern around having a need for technology to, in some ways, monitor that. So they were fully aware that actually with self-tracking, I can just keep going and going and going, and that could be dangerous for me. And actually some young people talked about parents or teachers actually getting to a point where they had to intervene and say, you need to take this app off your phone now. So fully aware, young people are very aware that this can be sometimes a dangerous practice as well. And one of these, there's very gender differences coming through, but one of the, I think, common things we were hearing was the issue of dieting for girls and then building muscles, boys and young men talking about that and trying to find apps and the sort of body image problems that were associated with its use.
So yeah, this leads us to, I guess, three sort of key points. As we mentioned, we've had a few webinars around this project that have happened over the last few months. The next event for us is in May, and we'll talk a bit about that in a moment. But it leads us to think about some of the policy implications. And really, if you're trying to think about what are the priorities in digital health today, where would you sort of locate your values? And one of the things we're quite concerned about is the way in which inequalities may be exacerbated by the drive towards digital health, whereas it's sort of predicated on the idea that it's making everything better. We can service more people in an overburdened NHS system. By doing this, everything's more efficient. It's apparent also that there's incredible limitations of accessibility, both in terms of the technological infrastructure, but also the literacy one requires to be able to make use of these platforms, coupled with the fact that the employment of digital solutions is to the complete neglect or redundancy of any other alternative. And so putting an emphasis on reaching those groups that are particularly at risk of being excluded is one key area we're kind of interested in. At the same time, we've talked a lot about digital literacy, but understanding that literacy around big data is one of those areas that we feel also is quite neglected, and even understanding what is big data or where it might be used. We get a sense of this within scandals like the Cambridge Analytica, but again addressing our comprehension of where our data gets used and how that might get used over a longer period is one thing that's also lacking too. And one of the things we're also conscious of is the importance of upstream engagement around some of these platforms. So this idea that, in fact, policy development should involve the participants, the users, at very early stages. so that we ensure that they are in fact meeting the needs of a range of different people rather than just delivering a system that is presumed to be better but which in fact has all kinds of other detrimental consequences for a broader sense of what healthcare can entail. So with those things in mind, we want to sort of finish up talking a bit about where we sort of see things going next. And in part because we are at a point where we're beginning to think what is the next stage of our project, what's the next stage of our research, and what are those things that we kind of need to be mindful of that are coming down the road that may have an impact on all of the things we've talked about. So we want to give a bit of an overview of these at the moment. Digital drugs is one area that seems particularly interesting here. So just to play you, this is a promotional video from a company called Proteus Technologies. And digital drugs are essentially medication with sensors built into them that will then connect with your mobile device and tell the device when the drug has been consumed. The initial aspirations is to improve things like drug adherence. But we rather think that in 20 years from now, all drugs will be digitally enabled. And what implications may this have for how we approach healthcare, but also how we approach sort of fundamental concepts like consent. The therapeutic license that's been awarded to its initial application is around such conditions as bipolar and schizophrenia. And the idea is that not only does it tell the person, the subject, the patient, the user, that the medication has been taken, but it also is shared with up to 4 other people. One perhaps could be the healthcare provider, another could be a significant other. So it creates the sort of relational idea of autonomy that in fact we may be encouraged or required to use these things and to share what would otherwise be personal confidential information as a condition of being a good healthy citizen. So there are, I think, deeper questions around surveillance around this, but also questions about how those fundamental concepts of medical confidentiality may be transformed as a result of it. We've heard a lot about AI over the last few years in healthcare. We've seen various people in the NHS champion AI in healthcare as a solution to the NHS crisis. So there's a general sort of trend in this direction, but not so much talk about artificial general intelligence, more stuff like the Babylon kind of semantic query system that is essentially trying to provide some degree of coherence to a range of insights about health. But what we need to get towards is a more general sense of intelligence beyond just this kind of query-based model. And we see some examples of that, I think, emerge at the moment. So this is a nice one that's still, I think, in development, but beginning to be rolled out at Alderhay Hospital, which is a children's hospital. And they've developed augmented reality and artificial intelligence platforms that are bespoke to your age. So they're trying to design things that young children can engage with. So this model, this chatbot, its language, its way of behaving will vary depending on your age and the level of education perhaps you may have, or age level of development you may have. So again, beginning to build in personalities into artificial intelligence is one key aspect of that general intelligence. At the same time, we see a number of examples of companion species, companion machines, if you like, that are providing evidence of them having therapeutic impacts on populations, which on the one hand you might look up and think it's kind of quirky, sort of odd, but in fact data's showing that these can provide real companionship to people. So imbuing machines with personalities, the capacity to relate to people on an emotional level is one of those trends around AGI that we're beginning to see. There's also, you may have heard about the phrase, the Internet of Things. The Internet of Medical Things is one particular instantiation of that. Here's a nice sort of example of that. This is Propeller Health, which is essentially an add-on to your inhaler if you have asthma, that will allow you to track your use of your inhaler using a mobile device, but also allow you to get a sense of the ambient environment around you whilst you have your inhaler with you. And so we're seeing things added on to the medication that we take in order to track this sort of information. And of course, a lot of this economy is built around sharing as well. So lots of people with this propeller added onto their inhaler, sensing the environment and providing real-time updates as to the level of pollution or contaminants that may affect your experience of asthma. And then platforms that are changing the interface of technology, one of which is this bracelet, the secret bracelet, which is using a projection-based technology to get rid of the device almost completely, or make our bodies the device. And there are quite a few examples of this sort of thing emerging at the moment, which are creating really different understandings of the human subject. There's one interesting implant technology called the North Sense, which is located on your chest, and it will vibrate when you are facing north. And the idea is it's giving you a sense of direction that perhaps we have lost as a species because of all sorts of other things that have come since the time in which we needed to navigate using the stars and so on. So these are rethinking our sense of human subjectivity, and the devices are creating new kinds of interfaces. A few years ago, I was one of the Google Glass Explorers. You might remember this device from a few years ago, which incidentally has been relaunched as of last year as an industry product. And one of the things I loved about Glass was it had this wink facility, so you could wink your eye and it would take a photograph, which frankly most people found a bit weird. And it is kind of weird if you wink at someone to take a photograph. But what was interesting for me was that it just changed the interface of what photography entailed, which was predominantly a kind of a hands-based interface, into something completely different. And so playing with interfaces, thinking about how wearable technologies are changing that, is one other interesting aspect of what's happening around this environment in which digital healthcare operates. As Emma mentioned, we involved and worked with Hazel Jones from NHS Digital a few weeks ago, who in fact is in a new position. So her role is head of apps and wearables. So the NHS now has a new role in this area, and we're kind of interested to think about where wearables is taking us. And one aspect of that is to look at things like this, which Emma sort of alluded to earlier, about these toy-like products which are tracking activity. And where you have children making wearables part of their everyday environment, into things like Zombies Run, which is a platform, a mobile running application where you put your headphones in your ears and you are the subject of a narrative in which essentially you have to kind of run because zombies are chasing you. And of course, the idea is to make you run faster or run more. And we see this expansion, therefore, of fitness and fitness tracking beyond just exercise into a more creative space. So again, we think this is a kind of expansion that is likely to change the demographic of people that are physically active by engaging them with a very different sort of proposition about what that involves and what may be interesting about it. We see also things like the Samsung Powerwall. This is a photograph from the Rio Olympic Games. The Samsung Pavilion was showcasing their sort of prototypes for new sort of gymnasium equipment in which you are interacting with screens and each other in a kind of competitive exercising gymnasium experience. So again, this idea that the tracking of physical activity of our biometric data is not just about us, but actually what's happening within the physical spaces around us. And one sort of interesting manifestation of that is in Populus's video imagining worlds in which, in fact, there's a whole sort of discipline emerging around media architecture and thinking about physical spaces that are designed to optimize digital interactivity, but in so doing also are kind of capturing information about us. An interesting company called PaveGem, which has created flooring surfaces which generate energy, storable energy, as people walk on them. So again, this idea that becoming a healthy citizen is in fact contributing to a kind of common good, if you like, by being physically active, not just your own physical activity and your own well-being. There's also been a lot of talk around blockchain for healthcare and how this may change the way in which healthcare is organized, managed, owned, and many companies that are beginning to explore this idea. And one of the things that I remember listening to an episode of BBC Click a few weeks ago with Gareth Mitchell, and you know, even after sort of a few years of blockchain, Gareth still doesn't feel able to explain it to people very well at all. And it's quite a challenge too. But I think that what's interesting about blockchain is essentially this kind of democratization of the data, which is its sort of underpinning ideology. So the idea is that instead of having an NHS, a single point that owns our data or has control of our data register, that data register is in fact, there are copies of it within all of our databases, and trust is enabled by knowing that everyone's got a copy, and if anything's modified, then everyone else is alerted to this. So this is in many respects sort of delivering the aspirations of Tim Berners-Lee when he said this is for everyone about the internet, and making it possible for everyone to actually feel that they are a stakeholder in a very tangible way with the data that's actually available. So we think blockchain will have a bigger impact on how we think about our data and how we think about the way in which it should be organized. And I'll hand over to you to wrap up the talk.
Sure. Okay, so we just wanted to flag up an event that we've got happening later this month, actually, which is at the House of Commons. And if you're interested, I'm sure we'd make some really good connections after this event that might feed forward into policy. So it's a House of Commons event. We'll be bringing some of the young people from our research, so they'll actually be speaking at the House of Commons, which is really exciting, and I think it will be a really good opportunity to hear firsthand from them in terms of some of the challenges, risks and opportunities. So if you want to sign up for that, that's the web link there. That's on the 16th of May, 6:30 to 8?
8:30, I think.
Yeah, 8:30. And then just also, if you want to connect with us and hear a little bit more about the project as we move more into some of the phase 3 results, we also have a website where we have people blogging for us from both health professions, various service roles, and numerous researchers. So we're really trying to build a community, a network of people doing research in this area. So we'd love to hear from you in terms of work that you're doing, opportunities to post your own work through that blog, and push out through the social media websites. So
Thank you
that's
very
it.
much.
Thank you.
So we've got time for questions? All right.
You were talking about digital footprint and you know how your whole life is now digital. I mean, your health, your life, where you've been, and so on. And I was just wondering, what advice would you give to protect your digital health? In other words, not allowing information to most inappropriate places. And one personal experience I've had is every year on the anniversary of one of my friends' birthdays, I get a post from Facebook to say, send blah, 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 best wishes. Well, blah, blah, blah died 3 years ago, and her children don't have access to her Facebook. And it's very, very difficult to say, you know, she's no longer with us. Also, another example, we know precisely when a friend of mine died because he was wearing a device which indicated when his heart stopped. And actually that formed part of a coroner's report on his death. But unfortunately, yesterday I got another message to say on ResearchGate to say, oh, your colleague has just published a paper on X, sends a congratulation email to him. And of course, I can't because he is now no longer here. So protecting your health, your presence, would you advise people to give the password you use to someone you trust to alter your page when you die?
Interesting. I think it's a very interesting question, and I think there's no simple answer to it. But I think that it's sort of there was an artist I worked with a few years ago who developed the idea of a digital sarcophagus that would then be sort of bequeathed to somebody upon their death, that would have perhaps all those things like the passwords or even just the computer and what was on it that they owned. And I think there's quite an interesting case to be made for thinking about that as part of your will, which is perhaps a reasonable way of doing something like passing on passwords at the point of death. We have no, I think, system to do that effectively, given how much we have to modify our password every 3 months or whatever it is. So then it sort of gets into, I think, that sense of relational autonomy, which some sort of ethicists talk about as being a kind of consequence of even the genetic age, that in fact we are, we ought to have some way of being able to share personal data with people that we trust. The challenge seems to be that you know, if I asked everyone here to open up their phones and pass them to the person next to them to have a look, most people wouldn't be too keen. There's something particularly personal or notably personable about digital information, in that it seems to hold everything about us. And it might be unique as a sort of thing as a result of that. I think also, though, it's useful to think about who are the specific individuals we have in mind, because it might be that the way in which we approach advice and guidance would differ if you're 12 years old, if you're 30 years old, or if you're 60 years old. And so even understanding the context in which those sorts of concerns emerge, I think is a starting point. And one of the things that we are sort of anxious about, particularly with the young people we're working with, is in fact the schools are quite poor at approaching some of these questions with their students. One of the things we'd like to try to set up is after-school digital clubs, where people could, you know, kids aren't even allowed to bring their devices to school. So the message is very much one of sort of fear and actually we don't want anything to do with this, when in fact we think that if you can nurture a greater sense of empowerment, you might get to a point where in fact those sorts of concerns about sharing a password with someone significant are much more feasible.
I think that whole issue of agency is a really, you know, interesting one in terms of young people. So if you think about how much is sort of pushed onto them now in terms of what data is available about them, where consent, you know, is questionable. So in America, the company FitnessGram goes into schools. It's a way of fitness testing young people, but it collects a great deal of data about young people's bodies, which is used not just as a way of sort of collating and getting a sense of the health of those young people, but it can be a tool to compare, contrast schools and teachers. So you can see how accountability, performativity within various industries, whether it's health or education, can be a driver towards collecting data to account and assess the performance of those people using that data about others. So I think on the one hand, there's advice we can give young people about through those clubs and sort of digital health literacy. But I think it's also a sort of broader conversation about the way in which big data companies now really drive what's happening, certainly in America and Sweden and other countries, what's happening in schools. So I think there's all sorts of questions about where that data goes and about young people, not just the data that they themselves are producing.
Yep.
Social media use in young people, because there's so many different platforms and they're using different devices, and it's so nebulous. I was just keen to sort of get any advice that you had in terms of how to sort of capture that data. So if it's young person X, social media use is this. Well, suggestions and tips.
I mean, I guess, as I mentioned, we're experimenting with WhatsApp. We had a lot of discussion about what we should use to try to access those kind of real-time experiences. And particularly, we thought about doing things like video diaries that they would then record, but there was something that we felt was particularly interesting about the real-time interactions. So one of our researchers, Sarah, that Emma mentioned earlier, will be engaged in the conversations in WhatsApp with the young people, so that there is this sense of immediacy and in terms of a relationship. So rather than them go off and use WhatsApp for a few weeks and then we meet up and talk about what happened, we've created a method for which they will feel a kind of continued presence of the researcher within that world, which part of the reason to do that is to get closer to this idea of the sort of natural environment. Rather than it being an artificial research project that then they're having to sort of immerse themselves into. Whether that will turn out to have worked, we don't really know at this stage, but certainly to go back to that idea of device ethnography, we think is particularly crucial because, as Emma mentioned, it's very easy for the participants to feel like you're not part of that world, and being part of that world to us certainly feels important in order to both sort of fulfill the sort of theoretical aspirations of the project, but also to really think critically about what sort of method is appropriate in this context. So the sort of short answer in terms of advice is that the platform, we were quite keen to find a platform that the participants are comfortable with as a starting point. So rather than think, let's explore Facebook or YouTube, whatever it might be, let's talk to the participants about what they're using, and then try to use that as a way of capturing the data, and that might be just a starting point.
I was sort of also thinking here of Sonia Livingston's work around, sitting next to a young person on their computer and doing the walkthrough of tell me what you use. And I think there's something about the journey through the way that different platforms are connected. So the wearable device speaking to social media, and then the algorithms suggesting other sites you might use, and young people telling us about that experience of being on YouTube, and the journey through and the connecting of different platforms, different devices, I think is crucial in that. So rather than just studying what are young people doing in Twitter, it's where does that take them? So and at that point, what choices do they make? So I think there's all sorts of other things we explored earlier on around sort of think about cartography and mapping and the journey that one individual might take, and where that data goes and who goes with that data, I think is something we haven't really explored a great deal in the research around young people's uses. But I'm kind of thinking, that sitting next to and the walking through on the phone is a starting point, I think. Yeah,
but even just to understand, this phone's a Samsung Note 8, which allows you, I guess other phones do it as well. It's kind of super long, but it's designed to have two apps open at the same time. And even there you can see how that may change the nature of the experience to be able to do that, to do two things simultaneously. And so understanding how those spaces, those screens are navigated around different kinds of information, which occupy different parts of our sort of social world, is something we're quite keen to get at. We haven't got something that tells us that sort of level of detail yet. Like how does a participant move from one application to the other? How much time do they spend on one? And that sort of level we're kind of fascinated to explore, but I don't know of a platform that does that yet. But it's perhaps gets into this idea that these experiences of accessing health information operate within a digital social context, rather than being just, you're not sitting down and looking for something for 30 minutes. You're moving between different platforms and perhaps even seeking advice and opinions of other people in the process of doing so.
Yeah, I think just to add to that, there's been a real call, I think, within the digital sociology community for ethics committees and people involved in funding to be more flexible and responsive and better understand, I think, the kind of ethical issues. I mean, it was such a long process for us, and rightly so. We're asking young people to communicate with us through WhatsApp, and there's some real ethical challenges around that. So I think we've got a long way to go, I think, as well, in terms of some of the ethical procedures and understanding around how we would really collect that data.
And simple things like if someone is on their WhatsApp and they share with us something personal, but they mistakenly share it with someone else, as can often happen in WhatsApp because of the nature of the interface, what is our responsibility there as researchers to that person if they become distressed as a result of it? How do we kind of provide support, but also how do we work with any other support systems around them to address it? And at the same time, it's sort of, there are aspects of this world that have become kind of normal and expected and commonplace, where you also don't want to over-support and feel like you kind of make something out to be a bigger deal than in fact it may be. Or even just helping someone understand how, if you share something in the wrong place or you'd like to delete it afterwards, how do you go about doing that? Building that understanding. Even something like, knowing that you can download all your Facebook data in a couple of clicks. Or even knowing that your data on WhatsApp may be backing up without you realizing it and switching that off, those sorts of things. Or knowing how to turn off the automatic media download in WhatsApp. Those sorts of things have become, we sort of fleshed out in a kind of guidance notes for the research team, which, we feel like we're just making it up really, but in dialogue with the ethics committee to sort of figure out some sort of best practices for both the participants but also the research team as well. Like, should you, wanting to make sure that the research is sort of protected as well, so giving advice as to only be sort of available during office hours, for instance. The idea of having our researcher in contact with participants at 11 o'clock at night, which may be when the participant is in fact sending stuff, we weren't too comfortable with. So those sorts of details have been quite fascinating to sort of think through.
We've got time for one more quick question, and then it will be lunch over in the library atrium.
I'm not sure where this question will go, but it's something that's going through my mind around regulation. We have, quite strict regulation around conventional health and face-to-face health, and potentially quite rightly so. And often that regulation has been instigated due to a mistake or an error. Do you have any experience or any comments around where regulation might go on around the artificial intelligence approach to health? Because it strikes me the speed at which AI is advancing, it may well be able to do a better job than conventional medicine can do, but maybe conventional medicine has been partly hindered by the amount of regulation that's there. Equally, in an aspect which is not so regulated, it could be that a mistake takes AI back 10, 15 years, because all of a sudden regulation blocks have to come in massively.
I mean, it's a good question. I mean, I just maybe think of the recent accident with the autonomous vehicle, which I don't think has rolled it back 10 years, but certainly has raised a question about how comfortable we are with accidents happening where they are the result of an autonomous vehicle. I mean, I think if you read the detail of this case, it was clear that there wasn't the vehicle really that was a reason for the accident, but it sort of resonates with this idea that in fact we are passing over responsibility to a thing that cannot be held responsible, and so it's a system that becomes responsible. I think in terms of the particular ethical questions arising from that, it strikes me that we have to again look at this as a whole within healthcare. There have been a few things in the last couple of months actually around the use of WhatsApp by clinicians who are using it all the time to share information about patients, to get opinions from their colleagues about a particular case. And with the new regulations, new European regulations coming in, there's the BMA are sort of telling doctors just don't do it, even if it's anonymized and doesn't indicate identity in any way. It's still just very risky to do so. So there's a kind of culture of use of certain platforms for which there isn't that sort of regulative or ethical guidance. It's just become a bit of a Wild West, as the internet often becomes. It emerges out of people's just everyday practice. With AI in particular, I think one of the concerns we've had about it is, again, the proliferation of the predictive capacities of AI and who owns those predictive capacities. One of the anxieties we have is that whilst so the NHS Digital at the moment have this call out to developers to develop applications for their library. And you might look at that and say, well, one aspect of that is the NHS wanting to be much more involved in the development of applications, rather than just have a kind of list of ones they think are great and direct people towards them. To actually be involved in the development and monitoring is quite reasonably a more responsible position to occupy. But I think we also have to be mindful of the fact that the data that is gathered by those private applications is perhaps providing a service that's useful for us, but gradually eroding the capacity of the NHS to remain competitive, because that useful data is outside of their environment. So there are questions about how far we're willing to allow commercial companies to privatize our data. I mean, I read something recently about Google setting up its own hospital, and you can see how, in fact, this is conceivable, because as more data goes into their system, the greater capacity they have to run away with it and to the neglect of any other authority. So having perhaps oversight on the predictive capacities of algorithms is one way in which this could be regulated. The challenge being, of course, that the business model of those platforms is predicated on them not sharing this. And I think that's the tipping point we need to get to be able to ensure we don't have these sorts of worries.
The other thing is, though, digital platforms can't do what clinicians can do in the itch that you can't scratch. So when you see something and you can go through your algorithm, but there's something about it which you can't put your finger on that just tells you that it's not following that algorithm.
Yeah.
I don't think any technology can actually, because no one knows what that is at the moment.
You mean it's a judgment?
It's a judgment.
Yeah.
It's a judgment of more than just you're not looking.
Yes.
When you're looking as a clinician, when I'm looking at a person, I'm not looking at a thing in isolation.
Yeah.
I'm looking at the holistic thing.
Yes.
And that's the bit that is to me the intriguing bit, that how will digital, from the sort of the smell of someone's breath to how they're looking,
Yeah.
that's what you can't, so all those things,
Yeah.
you can't just get to that point.
Yeah, I want to say yet at the end of your sentence. I mean,
You're absolutely right, there may be something better.
Yeah.
I can look back and say countless times when I've looked at somebody and something, the symptoms are telling me that, but actually what I'm seeing and feeling is telling me that.
yeah.
And I don't know what that is in me, and whether that's an experience, I don't know.
Yes. Yeah.
Thank you, Andy and Emma. And just before we go for lunch, I want to give you these as a small appreciation.
Thank you very much. Which one do you want? Thanks very
Thank
much.
you.
Thank you.